I've talked to my children about the fact that you can't, it's not just supplements, it's not just diet. You got to be sleeping, you got to be moving your body, and then these other modalities are going to quicken the process.
Yes.
Whether it's technologies, muscle testing, massage, chiropractic, acupuncture. Something that I've noticed, I just personally started acupuncture because my daughter needed it, and there's two beds in the room. And I thought, what a better way to bond with your daughter than to have to lay there and have her without her phone to talk to her for an hour. But on the times that I'm alone, it's also forcing me to stop, and it's forcing me to meditate, and it's forcing me to really become in tune with what's going on in my body and to imagine it. And that's where the mental physical component comes in. So I wanted to ask you, what do you do for your clients or your patients for their emotional health? And do you do something for that first, or do you get them in a better physical state before you work on the emotional and mental state?
So the fundamental thing is that everything has a reason. It has a physical component, a biochemical component, and a mental emotional component. Now, one of those components may only be 1% of their issue, but there's going to be a dominant thing. So if we take an emotional issue, let's say someone comes in, they do have an emotional issue, like they have depression, or have anxiety, or they have a phobia about something, or they're just stressed all the time and they know that they are. We got to look at what's driving it. Now, traditionally, most people do get referred in on the emotional side for something called NET, which stands for neuro emotional technique. When people get it done, they say it's like 6 months of therapy in a minute. Now, it's not therapy, it's two philosophies. One is traditional Chinese medicine, acupuncture, like you talked about, without the needles, and but using the same system. And then the other would be the observations of Ivan Pavlov, who's not a psychologist, not a therapist, not a psychiatrist, but he was a physiologist. His contention was that emotions are really more physiological than psychological, and our conscious mind needs to talk about things. And that's where psychology comes in. But the physiology of your emotions is really what runs the show. It's your unconscious, non-conscious mind that is reactive and that gets stuck in these patterns. What he called a conditioned response, like he showed with Pavlov's dogs, getting them to drool when they saw meat. And so using this NET process, which bridges those using functional kinesiological muscle testing, it looks like a magic show. It looks like it's unbelievable. I've demoed it every week in my health class for over 30 years, showing people, how their physical problems, their biochemical problems, even their emotional problems could be emotionally related, and it could change in within minutes.
Mhm.
And so it's dramatic to see. That being said, there are still people that come in that have emotional issues, that they think are highly emotional. They're taking medications, they're seeing therapists, they've seen a psychiatrist, they're even doing maybe holistic stuff, but it turns out they're in a car accident and they got their concussed. And it's just a byproduct of a brain injury. And unless you rehabilitate that brain and that nervous system, not just with an adjustment many times, but more with things like quantum neurology and upregulating the functioning nervous system so it can reboot itself, you'll never see them get emotionally okay. And then there's the biochemistry. I mean, there's things that people are doing that they have no idea. It might be one food they're eating that they're allergic to or hypersensitive to. It could be the one thing that sends them into like a Hashimoto's pattern that's has a whole list of emotional things that they're just indirectly or improperly taking thyroid meds to try and treat with just Band-Aid. And just like bucketing water out of a leaky boat, it's never going to change. And or there's some kind of like neurotoxin, some food they were just addicted to, or
Yeah.
mold in their coffee because they won't spend the extra money to get organic coffee, whatever it is, or stop drinking it, god forbid, right? Or maybe it's that bottle of wine I drink every wine. So we don't preach. I love food, it's obvious. um and but what we do preach is that if you do the crime, you got to do the time, which means that if you're going to do things to yourself on the negative, you need to have some biochemical hack, if you will, to really get yourself back into balance, which you can only do that for so long. However, doing nothing is ignorant, and it's not if, it's when, because health is not an event. it's there's only one way to coast in life, and that's down. You're either building your health every day or it is waning, as
Yeah.
you know. Yeah.
And it's and at an accelerated rate today versus
Yes, it
just
is.
20 years ago or just even 5 years ago. I mean, we have to be very careful with what we say, but just even 5 years ago, our world was different. We could eat
Mm,
things that we can't eat today, and I'm experiencing that right now. Um, but I love that you say you've got, we're all human. We're all wanting to eat certain things, and I have a lot of people that come in and say, I don't understand where this weight is coming from. I hardly eat all day. I intermittent fast. I go to Orange Theory and I go for a run, and I'm eating low carb. And then, oh, do you have any drinks at night? Yeah, I have about 3 to 4 glasses of wine, but there's no fat in it. And, I actually just did a post on the fact that none of this stuff works if your liver's not working because it's got to process the proteins and the fats and the alcohol. But we're all interconnected, the emotional, the mental, the spiritual, the physical. And I also see a lot of people on ADHD medication, antidepressants, anti anxiety drugs when really maybe it's just their thyroid and they
mm,
haven't gotten a full thyroid panel done, and doctors are only looking at the TSH and they're not looking at the full panel to see what's going on. And so there's a bigger picture, and the biggest message that I try to send is you are your best doctor. So if you're not feeling great and your doctor says you're fine, or that you're supposed to gain weight when you're in menopause, or we're all stressed out, that's just stress, go find another doctor.